This lecture is on the overload of the respiratory defense system. So large quantities of airborne particles may overload the respiratory defense system. So the respiratory defense system is good at what it does, but on the other hand, if you have too many particles in the air at once, you can overload this system, and then we get problems. I'll even write that in. This can lead to problems. So, first of all, there's the problem with irritants. Irritants in the lining of conducting passageways may lead to the formation of abscesses. What did I just say? Basically, there can be things in the air, for instance, in polluted air or smoke-filled air or things like that. You can just have things in the air that are irritating to the lining of the trachea or the linings of the bronchi and so on. And that can lead to abscesses forming. And irritants, and these can be chemical irritants or they can just be particulates, I should explain. Irritants then may also damage other lung tissues, leading to the formation of scar tissue. And this reduces the elasticity of the lung. What did I just say? What I mean is this. Remember what I've said in previous lectures. Your lungs are full of elastic tissue. That is what allows your lung to expand, contract, tolerate great changes in volume. Scar tissue is not elastic. So when you have scar tissue woven into your lung tissue, you can't expand as fully. They will not contract as easily. So as I said, this reduces the elasticity in the lung, and it may also, depending upon where the scars formed, it may also restrict airflow. So depending if you have scar tissue in the wrong places, it can actually be restricting the airflow through some of the conducting passageways. And irritants or particles may also enter the lymphatics of the lungs, producing lymphatic inflammation. And when you are dealing with chronic irritation, and stimulation then of the epithelium and its defenses, this actually causes changes, here's the important part, causes changes in the epithelium itself, that is to say, in your cells, that increase the likelihood of lung cancer. And unfortunately, lung cancer is one of those things that by the time you know you've got it, it's probably too late, because severe symptoms develop slowly and may take 20 plus years to appear. Now, I want to explain briefly what cancer is so that you understand what's going on here, at least a little bit. Cancer is always at bottom a genetic disease, but not of the genes that you pass on to your children necessarily. But what happens is that you wind up with small changes taking place in the DNA of your individual cells. So for instance, your skin cells, if they are hit by sunlight, strong sunlight, ultraviolet light often enough, some of the DNA in your individual skin cells can wind up changing. The same thing can happen if you wind up having chronic irritation in your lungs. You can actually wind up having some of those cells get changes in their DNA deep inside your lungs. And with cancer, the way it works is that usually one change in DNA will not produce cancer. It has to be several. But you can think of it as being like a light that you have to have all three switches on before the light will light up. So you've got a light bulb and it's got three switches. So you flip the first switch. That switch is now on, but the light doesn't light up. You don't have cancer. If you just go on like that for the rest of your life, that cell doesn't develop cancer. But at some point, if that cell then winds up getting, or its progeny, if those cells that it winds up making more of, because remember, epithelium reproduce very rapidly, if then you wind up having a second insult to that epithelial cell take place, so that its DNA is mutated again. Mutations are changes in DNA, remember? So if you then wind up having that second change take place, the next switch has been flipped. The light bulb still isn't on. You're still okay, but you've had two genetic changes taking place. Then finally, you get that third mutation, that third irritation causing the mutation. The third, if it's skin, it could be ultraviolet light. In your lungs, it could be tobacco smoke, it could be pollution, it could be any number of things. You then have that final bit of irritation that changes the DNA in that cell line again. The third switch is flipped. Now the light goes on. Now you've got cancer. So cancer is, as I said, at bottom, always a case of the DNA in certain cells being mutated several times during the course of a person's lifetime, such that eventually that cell line becomes cancerous. Now you've got a cancer on your hands, and those cancer cells are going to reproduce the way that cancer cells do. Now, this is also, again, why you can see with a lot of cancers, like lung cancer, you don't see it until very late in the game, after all three switches have been flipped, or however many switches there are. But the problem is that if one of those lung cells has gone through that transition, probably many have, and you're going to wind up with lung cancer at that point. And lung cancer that late in the game has a very bad prognosis. So there are certain kinds of diseases associated with certain jobs, certain lung problems associated with certain jobs, and it happens so often that they actually have names. So I'm going to do a little bit of that. There are specific ways that the respiratory system can become overloaded, and one of those is called silicosis. And this is produced by inhalation of silica dust. Now, silicon is very common in the environment. It's what most rocks are made out of. So if you are in some kind of a profession where there is a lot of grinding of rocks, of exploding of rocks, or this kind of thing, there's some danger for that. So for instance, people who work in mines, where in order to even get to where they want to mine, it may involve sawing off large quantities of rocks. There you can wind up getting silicosis if you breathe that silicon dust, that silica dust rather. If you breathe that silica dust every day for many years, then you can wind up with silicosis. There is also asbestosis, and this is produced by the inhalation of asbestos fibers. Now, asbestos is bad for your lungs in many different ways. We are still studying the various different ways that asbestos is bad for your lungs. Suffice it to say, you don't want to inhale it. The problem is that asbestos is also a really good fire retardant. So it was put into lots of buildings in a certain era because it was seen as a safety measure. So most old buildings have asbestos in them. And that means that if construction needs to be done on those old buildings, or if the old buildings need to be knocked down or anything like that, the asbestos has to be removed separately and very carefully. So, as I said, this is a common problem in buildings built in a certain era because we did not yet realize that asbestos was so cancer-causing. Then there is anthracosis, and this then is produced by the inhalation of coal dust. One of the types of coal, the type that is most usually mined, is called anthracite coal. So anthracosis then is produced by the inhalation of coal dust. This is the disease more commonly known as black lung. It is very common among coal miners. Basically, if you are mining coal every day of your career, there's going to be coal dust in the air. If you don't have proper protection, if there's not decent ventilation in the mines and protection of every worker, then the workers that stay long enough do wind up developing black lung. It's a very, very common disease. It used to be very common, almost universal among coal miners. Then the incidence of both black lung and silicosis went way down when a lot of workplace protections were put into place. Unfortunately, black lung is again on the rise now. So as I said, in the coal mining regions of this country, you will have people with black lung. Now, there is also an interesting one that I'm just going to briefly talk about as well, sometimes referred to as flock workers' lung. And this is basically this is caused by the inhalation of what are called flocking fibers. Okay, this is something you may see in New England and other places where there is a textile industry, because flocked fabrics are non-woven fabrics. So they're fabrics like felt, they're fabrics like polar fleece and things like that, that are more or less made like paper mache, where you have lots of fibers that are put into a fluid, and then the fluid is slowly dried and compressed. And you wind up with these fibers that are all kind of glued together in this final fabric. But the problem is then that in a flocking factory, you're going to have some of these fibers flying around in the air. And again, if there is not adequate protection for the people who are breathing in that space, they can wind up inhaling a lot of these flocking fibers, and they can wind up getting a disease of the lungs, which is normally very rare, but winds up showing up in unreasonable numbers, I'll put it that way, non-accidental numbers, in people who work in some flocking factories. So that is something to look out for in areas where there are textile industries. So those are different things that can go wrong. Basically, when the respiratory defense system is overcome, when it is overloaded with more than it can process, you wind up getting these sorts of problems. Thanks very much.